Assalamu alaikum. I am Dr. Zahabia Suhail, resident gastroenterology at the Khan University Hospital, Karachi, Pakistan. The topic of my abstract is risk factors and outcome of upper GI bleeding in hospitalized patient in a tertiary care hospital. This study is conducted with Dr. Filza Bachani and Dr. Om Prakash at the Khan University Hospital. So GI bleeding is in hospitalized patient is an important cause of morbidity and mortality. The incidence of hospital-acquired GI bleeding varies from 0.17 to 5%. By determining the common risk factors of upper GI bleeding in admitted patients and due to availabilities of better modalities of treatment, such events can be prevented. Therefore, the study is conducted to evaluate such cases and to provide a better understanding and predictability of risk in hospitalized patients. So the objective of my study is to determine different etiologies and outcomes of upper GI bleeding in patients while in hospital. Methods and material. This is a retrospective study which was conducted in patients admitted to the Aga Khan University Hospital during 2019 till 2021, almost for the period of 1.5 years. All patients admitted for non-GI disorders who developed upper GI bleeds as inpatient bleeds were considered cases, and their clinical characteristic, cause of bleeding, and clinical outcomes were reviewed. So in result, 47,337 patients were hospitalized during the study period, and amongst these, 147 patients developed GI bleeding, upper GI bleeding, and which makes the percentage of 0.3% only. If we see the variables of of these patients who were admitted, so mean age of the patients was 62. 66% of the patients were male and 33% of the patients were female, and majority of the patients had other comorbids like hypertension, diabetes, ischemic heart disease. A less number of patients had CKD, chronic liver disease, CVA, carcinoma due to any cause, COPD, arthritis, arrhythmia, and dyslipidemia. So if we see the presentation, so mainly 85% of the patients had overt GI bleed in the form of hematemesis and or melena, and majority 40% of the patients had hematemesis mainly, while 15% of the patients had drop in hemoglobin only with no overt. If we if we see the primary diagnosis with which the patients were admitted and then developed upper GI bleed, so majority of the patients were diagnosed with COVID pneumonia. That means out of 147 patients, 26 patients had COVID pneumonia, 18 patients had non-COVID pneumonia. After that, the major diagnosis with which the patients were admitted and developed GI bleed was stroke, acute coronary syndrome. Then less number of patients had encephalopathy, septic shock, UTI, AKI, cardiogenic shock. And then there's a list of other diagnoses with which few numbers of the patients develop GI bleed. So mainly majority of the patients on which we got the consult for upper GI bleed were patients were admitted in internal medicine service, and then followed by internal medicine. The other services which called us for the presentation of upper GI bleed were oncology service, and then neurology, cardiology mainly, while next comes gastroenterology service itself, and very few patients were found in orthopedics, cardiothoracic surgery, and general surgery as well. So, majority of the patients, amongst all the patients who developed upper GI bleed, 23% of the patients were on Ascard, 24% of the patients were on dual antiplatelets. So, 27% of the patients were on therapeutic anticoagulation, and 55% of the patients were on prophylactic anticoagulation. 4% of the patients were given NSAIDs, and 8% of the patients were given steroids. So, in case of treatment, majority of the patients were conservatively managed with omeprazole. That means for 67% of the patients, we had to give infusion of omeprazole to control GI bleeding. 26% of the patients were given omeprazole in BID doses, and 6% of the patients were given in QD dose. And out of these 147 patients, 24% of the patients underwent endoscopies, and the source of bleeding were identified as mainly ulcers. So 5.4% of the patients amongst those who underwent upper GI bleed, 5.4% of the patients had therapeutic measures to control bleeding, while the rest of the patients had bleeding controlled with IV omeprazole. also the and also patient's deterioration. Mortality was seen in 24% of the. If we see the independent risk factors for bleeding included age greater than 60 years, male gender, pneumonia, stroke, acute coronary syndrome, renal insufficiency, sepsis, being on a medicine service, and anticoagulation as well as the major risk factors for bleeding. Limitation of my study is that it was done during the COVID pandemic period. So there was risk of doing endoscopies, therefore patients were treated conservatively mainly, and other limitations include sample size, age limit, limited to the patients in AKU only, and limited to the patients admitted during 2019 till. So hospital acquired GI bleeding is very uncommon. In this study, we identified several independent risk factors, and larger scale studies assessing the role of increased comorbids and antithrombotic use in this setting are warranted. Thank you.